Good afternoon, dear friends. We continue our lectures in endocrinology. Again, you should write in the Zoom chat only your questions. Program fixed you automatically. That's why let's start. Previously, we discussed diabetes mellitus. Today, we start talking about another very common disease, about disorders of thyroid gland, the disorders of thyroid gland. And today, we'll talk about thyroid axis. Why we talk about axis? Because this is not only thyroid gland participates in the regulation of thyroid hormones production. So, first of all, the metabolic rate of many tissues controlled by the thyroid hormones, and overactivity and underactivity of the gland pose the most common of all endocrine problems. Anatomy. Of course, you know that the thyroid gland consists of two lateral lobes connected by an isthmus. It's closely attached to the thyroid cartilage and to the upper end of the trachea, and thus moves on swelling. It's often palpable in normal women. So this is a picture again. We have two lobes, we have isthmus, this is thyroid cartilage, that's why thyroid gland, this is trachea, and that's why when we are swallowing, actually thyroid gland can move. And again, sometimes it may be palpable even in healthy women. Biochemistry. Thyroid hormones T3 and T4, we have two thyroid hormones, T4 and T3, are synthesized within the gland. More T4 than T3 is produced, but T4 is converted in some peripheral tissues like liver, kidney, muscles to more active T3. That's why we have T3 and T4, but the most active is T3. And again, mostly thyroid gland produce T4, and then peripheral tissues converted into T3. In plasma, more than 99% of all T4 and T3 is bound to hormone-binding proteins, and only 3 hormones are available for tissue action. Their T3 binds to specific nuclear receptors within the cell. So, actually, you know that hormones produced in very small amounts and act in very small amounts. But for thyroid hormones, even most of these hormones bind to proteins, and this is like depot, some pool of hormones. When our body needs these hormones, we have convertation, we have release of these hormones, which act and change exchange processes in our bodies. So, you know that thyroid hormones produced from tyrosine, this is amino acid. What's the most important? That for production of thyroid hormones, we need what? Iodine. Almost all iodine we eat used to produce thyroid hormones, and even named T3 and T4. Why we have T4, T3? T4 contains 4 atoms of iodine, T3 contains 3 atoms of iodine. That's why again, mostly we have production of T4, in T4 converted to T3 active, no, and then actually it produces its actions. Why we talk about axis? Because the main question, how thyroid gland knows how much to produce thyroid hormones, because you know that overproduction and underproduction lead to serious consequences, because underproduction and overproduction, this is disorders. But how again thyroid gland knows to stop production or to start production, increase production, decrease production? We have special regulatory mechanisms. And first we should talk about thyroid releasing hormone, which produced by hypothalamus. Released and produced by hypothalamus, you know, this is specific part of our brain. Then, in pituitary, we have TSH, thyroid stimulating hormone. Thyroid stimulating hormone. Thyroid stimulating hormone stimulates TSH receptors in the thyroid to increase synthesis of both T4 and T3, and also release of stored hormones, producing increased plasma levels of T4 and T3. All this work due to so-called feedback mechanism. Feedback mechanism. What does mean feedback mechanism? That when production of T3 rise, production of stimulating hormones TSH decrease, and vice versa. When we have low levels of T3, we have increased production of TSH, and the result stimulation of production of T3 by thyroid gland. That's why we talk about feedback mechanism. And again, decrease of production of TSH, increased production of TRH, which increase production of TSH, and vice versa. So we have few feedback levels when we talk about regulation of thyroid hormones production. Okay, when we talk about endocrine disorders, actually, we have two problems when we talk about all hormones. This is hyperproduction or underproduction. Both, this is bad. Because hormones in normal exchange process in our body. So when we talk about problems, about disorders, first of all, let's talk about hyperthyroidism. Hyperthyroidism, this is overproduction of thyroid hormones. No, actually, few words, what actually thyroid hormones do? No, you know, for example, insulin do one thing, decrease sugar levels. Glucagon, vice versa, increase sugar levels. Thyroid hormones, they have much wider actually effects in our body. First of all, thyroid hormones accelerate exchange processes in our body. Accelerate exchange processes. What does mean exchange processes? This is synthesis and production and of actually proteins. Thyroid hormones increase sugar levels. Thyroid hormones increase production of energy in our body, stimulate production of energy in our body, because all these enzyme processes, and actually hormones, they stimulate these enzyme processes. And thyroid hormones increase decomposition of different proteins, lipids, and actually, you know, we talk about anabolic hormones and catabolic hormones. Anabolic hormones to overgrowth of increasing of something, of production of something, the anabolics. Catabolics, vice versa, cause destruction of something. And totally increasing exchange processes in our body, thyroid hormones, this is catabolic hormones. They produce more energy, but this production of energy is due to destruction of proteins, lipids. So this is catabolic hormone. But generally, it accelerates all processes in our body. Accelerates all processes in our body. Exchange processes becomes faster and produce more energy, more everything. What else thyroid hormones do? Thyroid hormones interact with other hormones because all this endocrine system, this is very complicated system and works together. All hormones work together. For example, thyroid hormones, they increase sensitivity of tissues to catecholamines. You know catecholamines, epinephrine, stimulate heart rate, nerve system. And actually, thyroid hormones can do what? They can't increase production of epinephrine, but catecholamines. But thyroid hormones can increase sensitivity of peripheral tissues to catecholamines. As a result, normal level of catecholamines lead to action as patient has a lot of epinephrine in his blood. It's very important to know when we'll discuss clinical presentation of thyroid disorders. What else thyroid hormones do? Thyroid hormones very important for normal development of our body, especially development of nerve system. That's why in case of deficiency of thyroid hormones from birth, it leads to very serious consequences. This is usually people with low height, with cretinism, so inability to think proper way. So again, thyroid hormones very important for development of our body, especially development of central nervous system. Okay, now let's talk about problems, about disorders. And first group of disorders, this is hyperthyroidism. Hyperproduction or thyroid overactivity or thyrotoxicosis, we use the term. Why we use such term thyrotoxicosis? Because high dosages of high levels of hormones, they're toxic for our body. They lead to consequences as poisoning of our body. So hyperthyroidism is common, affecting 2 to 5% of all females at some time and with a sex ratio 5 to 1. And meaning what? That hyperthyroidism, this is women problems. Women suffer 5 times more compared with men. No, usually most often between ages 20 and 40. No, nearly all cases, more than 95%, caused by so-called intrinsic thyroid disease. Intrinsic thyroid disease. Again, hyperthyroidism is not a disease, it's a syndrome. Like a fever is not a disease, it's a symptom, and hypertension is not a disease, it's a syndrome. And if you have patients with hyperthyroidism, you should find out what is the reason, what disease caused this hyperthyroidism. And actually, among disorders, we have common disorders. Number one, this is so-called Graves' disease or diffuse toxic goiter. Graves' disease or diffuse toxic goiter, we'll talk about this disease later. It may be toxic mononodular goiter. It may be toxic nodular adenoma. So, meaning what? That we have some, for some reason, thyroid glands start producing more thyroid hormones. Sometimes the total overproduction, so the whole gland start producing hormones. Sometimes we have some nodules inside thyroid gland which produce a lot of hormones. Now we have uncommon causes, for example, acute thyroiditis. You know, when you have inflammation of thyroid gland, what may happen? Inflammation causes destruction of cells, death of cells, and all hormones from cells, they just released into blood. And in this case, we may find actually hyperthyroidism. No, sometimes exogenous iodine, you know, that to produce actually thyroid hormones, we need iodine. And usually people deal with lack of iodine, causing hyperthyroidism, low production of thyroid hormones. But if for some reason patients take a lot of iodine, it may even cause hyperthyroidism. Some drugs, for example, amiodarone, which used to treat patients with arrhythmia, also may cause actually hyperthyroidism. No, and rare cases like actually some tumors, for example, which may produce thyroid hormones. Okay, among all causes of hyperthyroidism, number one, this is so-called Graves' disease. Graves' disease, or proper name, diffuse toxic goiter. Diffuse toxic goiter. Goiter, this is what? Goiter, this is enlargement of thyroid gland. Goiter, this is enlargement of thyroid gland. Diffuse, meaning that the whole thyroid gland becomes bigger and produce more actually hormones. Now I'm toxic because I told you that thyroid hormones may be toxic for our body in big amounts. So, Graves' disease or diffuse toxic goiter, this is most common cause of hyperthyroidism and due to autoimmune process. So, it's very interesting disease because usually when we talk about autoimmune disorders, what does it mean autoimmune disorders? This is when immune system produces antibodies against our own tissues. And this is bad because immune system for some reason decided that this is enemy and let's kill. And that's why in case of autoimmune disorders, we have damage of our own tissues, they're attacked by antibodies and finally killed by our immune system. And in this case, no, again, remember, I told you about diabetes type 1. In diabetes type 1, this is also autoimmune disease. We have attack of Langerhans cells, of beta cells of Langerhans islets by autoantibodies. And what is the result? Beta cells killed, and we have deficiency of insulin, no insulin, and we have diabetes mellitus. That's why usually autoimmune disorders cause decrease of production, cause decrease of functioning. But in case of Graves' disease, vice versa, we have increase in functioning. How it's possible? Again, mechanism is very interesting. In case of Graves' disease, we have specific immune globulins G antibodies, but these antibodies bind to thyroid TSH receptors. Because how all this endocrine system work? We have some glands which produce hormones, we have hormones, but what hormones do? Hormones should attach to some receptors. And when, for example, we have receptors of TSH in actually thyroid cells, the thyrocytes. And remember, what for we need TSH? TSH, thyroid stimulating hormone, increase production of thyroid hormones. And normally we have feedback mechanism. Right? TSH stimulate production of T3, T4. When T3, T4 increase, production of TSH decrease. As a result, we have maintaining of thyroid hormones on some level. In case of Graves' disease, we have antibodies which attach to TSH receptors of thyrocytes. No, receptor, antibody, attached. What thyrocytes believe or think? That this is TSH. If this is TSH, let's do what? Let's increase production of thyroid hormones. And that's why we have overstimulation of thyrocytes. Thyrocytes and thyroid gland totally produce a lot of thyroid hormones, but feedback mechanism can't work. Because actually antibodies production doesn't depend on TSH on T3, T4 level. And that's why we have overproduction of thyroid hormones. We have overproduction of thyroid hormones. We can even detect these TSH antibodies in the serum. Now we have some association HLA, so meaning what? This is some genetic predisposition, for such condition, but still we don't exactly know why it's happened as for other autoimmune disorders. Okay, what about clinical presentation? You know, when we talk about endocrine disorders, on one hand, usually we have a lot of signs and symptoms. As actually, for example, thyroid hormones, they has not only one target for action. They actually exchange processes in all tissues, in all body, in all organs. That's why all organs involved. All organs presented with some actually presentations, symptoms. And it seems that it's easy to find diagnosis because if you have a lot of symptoms, it's easy to find actually proper diagnosis. Let's see what happened with patients. Symptoms: hyperactivity, irritability. This is first group of symptoms. Hyperactivity, irritability. Then heat intolerance and sweating. Heat intolerance and sweating. Then palpitations. So actually this is acceleration of heartbeats with actually patient feel these heartbeats, palpitations. Fatigue and weakness. Fatigue and weakness. Weight loss with increased appetite. Weight loss with increased appetite. Diarrhea. Diarrhea. Polyuria. Oligomenorrhea, loss of libido. Loss of libido. You see how many symptoms? How many symptoms? Okay, let's find proper diagnosis. But what's the problem? You see that we have symptoms which tell us about different organs and systems. For example, diarrhea and weight loss, we think about gastroenterological problems. Palpitations, we talk about heart problems. Irritability, about actually nerve system problems. And in some cases, when we see so many signs, no doctors believe, okay, this patient has problems with heart, or has problems with nerve system, or has problems with actually gastrointestinal system. And sometimes doctor miss the idea that all these signs all these signs. This is presentation of only one disease, of thyrotoxicosis. Again, that's why sometimes a lot of symptoms don't help us to find proper diagnosis. Don't help us to find proper diagnosis. Okay, let's talk about these symptoms. Let's talk about these symptoms. Why these symptoms appear? Why these symptoms appear? And okay, I told you about symptoms, and also we can talk about signs. So what we can detect on examination of patient. This is what? Tachycardia, atrial fibrillation. Tachycardia, atrial fibrillation. No patient feel palpitation. Actually, you can detect tachycardia. Tremor, vibration, tremor of fingers especially. Goiter, this is enlargement of thyroid gland. Warm, moist skin. Warm or hot, moist skin. Muscle weakness up to proximal myopathy. A leg retraction of leg, so this is ocular signs. Gynecomastia. So you see how many different signs also may be found. This is ocular signs. This is actually tachycardia, hot signs. Moist, warm skin, what is sign? I don't know. So again, a disease when we have a lot of presentations, but sometimes difficult to find proper diagnosis. Okay, let's talk about signs and why all these signs appear. To understand why these signs appear, we should again about what thyroid hormones do. Thyroid hormones told you about acceleration of exchange processes, and actually total or catabolic effect, because we have both acceleration of production of something and acceleration of destruction of something. But destruction overweights production. That's why totally this is catabolic hormones. How we can see this? Thyrotoxicosis may cause unexplained weight loss despite enhanced appetite. So what does it mean? What patient tell you? That actually patient eats normally. Patient has very good appetite, but his weight decrease. And it's sometimes advanced decrease. Actually, patient may lose 5–10 kilos during some few months. Again, patient eat normally, patient hungry, patient eats sufficient amount of food, but his weight decrease. Why it's happened? Because it becomes higher than production of proteins, lipids, of everything, and this is effect of actually thyroid hormones. Again, please remember, weight loss, this is one of the most important signs of thyroid problems. Okay, let's return and talk about actually eat, complain, and I'll try to explain why it's happened. Again, we talk about weight loss with increased appetite. What else happened due to increase exchange processes in our body, acceleration of exchange processes in patient's body? You see, heat intolerance and sweating. What we are talking about? I told you that patients eat a lot, patients eat normally or even sometimes more. Exchange process is accelerated in our body. It means that more energy produced in our body. But you know, when we, I use actually my energy to do some mechanical work. But when I do this, not 100% of energy used to mechanical work. In all cases, some part of energy used to produce heat. Well, this is like actually engine in the car. You know that engine in the car move the car, but on the same time it's produce a lot of heat. The same happens in our body. Energy used to produce some work, but some part of energy produce actually heat, just produce heat. This is waste of energy. No, for us it's good because we know where biological substances which need some definite temperature. And that's why it's good when we can produce heat in our body. Yeah? But in case of hyperthyroidism, we have overproduction of this heat. And patients with hyperthyroidism may produce 2 times more heat than in normal cases happens. That's why what happens, what patient feel? No, he feels that he is hot all the time. Yeah? And that's why these people, because it's summer, they produce a lot of heat inside, but they should to remove this heat outside. No, when it's cold weather, it's easier to do. But if it's hot, temperature 40 centigrade in summer, how to remove this heat? That's why patients feel themselves very bad when environment is very hot. And vice versa, they feel themselves good in winter when outside temperature is low. You know, patients, even in winter, they don't like to use the, you know, warm scarves, some gloves or clothes. Again, they just use very actually teeny stuff and actually feel themselves very good. Even we use such term as blanket sign. For example, in winter, patient cover himself only with thin blankets instead of warm cover. Sweating, because sweating, this is one of the most efficient process how to reduce temperature. How to reduce temperature, because we have perspiration, water from surface of our skin, and decrease temperature. And that's why if patient produce a lot of energy inside, to remove this energy, or here this process of perspiration and sweating also switched on. And that's why patient feel himself wet all the time due to perspiration, especially patient wake up in the morning and he feel that all his underwear is wet. Again, due to this intensive sweating. Why it happened again? Trying to remove this energy, trying to remove this heat out of the body somehow. So again, this is due to overproduction of heat, due to acceleration of exchange processes in our body, the heat intolerance and weight loss. Heat intolerance and weight loss. Why fatigue and weakness? You know, in case of thyrotoxicosis, this is overproduction of energy lead to the fact that a lot of energy used for nothing, just to produce heat. And to do mechanical work, actually we have lack of energy. That's why patients may experience fatigue and weakness. Okay, next group of signs. Let's see what we can find. Hyperactivity, irritability, palpitations, diarrhea. How we can explain these signs? You know, remember what I told you. One of actions of thyroid hormones. This is increased sensitivity of peripheral tissues to epinephrine. You know what is epinephrine or adrenaline? Adrenaline, this is catecholamine, this is hormone of sympathetic nerve system, and this is so-called stress hormone. Because we have epinephrine in our blood when we should do something, running, jumping, fighting. In this case, we have actually epinephrine in our blood. What happens in patients with thyrotoxicosis? Suprarenals produce normal amount of catecholamines, of epinephrine, but sensitivity of receptors, because epinephrine also acts as hormone. We have epinephrine, we have receptors. When they touched, we have something, acceleration of heart rate, for example. In case of thyrotoxicosis, sensitivity of receptors to epinephrine increase. And it means that normal amount of, or normal levels of epinephrine in blood, huge amount of epinephrine in blood. And what happens if we have overstimulation of sympathetic nervous system? If we have overstimulation of tissues by epinephrine? We have clinical results as palpitations or tachycardia. So, you know that epinephrine accelerates heart rate, and patients with thyrotoxicosis, one of the most important signs, this is continuous or constant tachycardia. Usually patients with actually thyrotoxicosis, they have heart rate more than 100 beats per minute. 100, 110, and this 100 even at rest, at night, this is constant tachycardia, constant tachycardia. And if you have patients with normal heart rate, no, this is not thyrotoxicosis, because one of the most important signs, this is tachycardia, and patients feel this tachycardia as palpitations, By the way, this is bad for the heart, because if heart can't have a rest, sooner or later, heart tired, that if you beat your horse all the time, forcing the horse run 24 hours, sooner or later, horse that will die. And the same happens actually with the heart. If hormones stimulate and beat the heart all the time, sooner or later, heart fail. So this is palpitations. This is due to this effect for presentation of epinephrine or sympathetic nervous system. Then, early and very important sign, this is changes in nerve system. You know, patients with thyrotoxicosis, they become, you know, very hyperactive. They become nervous. They become irritable. Now, how it's seen in daily activity again. Patients start create conflicts. Now, just imagine when you're very nervous, when you're in stress, when you're in stress. Remember when you're at stress, and they say, but patients with thyrotoxicosis experience this 24 hours, he all the time in stress because of overactivity of sympathetic nerve system. And that's why patients becomes very nervous. They becomes very active. They become very movable, you know, even when you see such patients. These patients, when he enters your office, he's very nervous. He predict and be patient and talk. No, he even talk very fast. He don't let you come to reply. He talk, produce some movements, move his hands. He's very talkative, difficult to stop. Patient with thyrotoxicosis. He try to tell you everything. Actually, and we see, in practical life, we see that patient is very nervous, very nervous. This is not nervousness. This is actually presentation of this disease. And what's important? Patient realize that this is not normal. Patient can't explain, everything okay in family, at work, but why I'm so nervous? Due to this, actually, patient can't sleep normally, because when you're in stress, you can't sleep normally. Patient becomes very irritable. You tell something to patient and he starts crying, for example, or becomes angry. Again, if he do some mental work, he can't concentrate. He can't concentrate on one thing. His mind also jumping. He starts thinking about one thing, then about another thing. It's very difficult to concentrate for him. You just imagine again, when you're in stress, it's difficult to do some actually mental, to do some actually work, which you need to calculate something or doing something. So all these lead to the fact that okay, as a result, so actually we have such problems. As a result, we have such problems. So, what else? Next presentation. Next presentation. Next group of signs. Next group of signs. This is actually ocular signs. This is ocular signs, and we have some pictures. We have some pictures. Okay, this is typical view of patient with pyrotoxicosis. Typical view of patient with pyrotoxicosis. You see these widely open eyes. You see these widely open eyes. Sometimes we tell that patient look like as he's afraid of something. Or patient actually look like as he is angry view. Sometimes we tell. You see these widely open eyes. Widely open eyes. Eyes look like it's very big. Actually, eyes can't be as big. This is just happened. You know, we need upper lids, and this angry view happened due to lid retraction. Lid retraction. You know what happened? Again, remember about this sympathetic nerve system. When you're in stress, when you're actually afraid of something, you try to open eyes widely, trying to find out what have happened. What have happened? So actually, so you widely open eyes trying to understand what happened. The same happened actually in case of pyrotoxicosis. It happened in case of pyrotoxicosis. You know, because eyelids, they often moved by specific muscles, specific ocular muscles. Yeah? We move our eyeballs, we move our eyelids by using specific muscles. And actually, these muscles also may become nerviness. You know, like actually, intestine becomes nerviness, that as fingers becomes nerviness, this eyes becomes nervous. We have widely open. This is known as ocular signs. This is ocular signs. What else? Maybe tremor, tremor of fingers. Again, this is due to the same nervousness. Remember yourself. If you are in stress, sometimes you see shaking hands. Shaking hands when you're in stress. The same happens in pyrotoxicosis. Because patient with pyrotoxicosis in stress all the time. Patient in pyrotoxicosis in stress in all time. In stress in all time. So actually, next, what may happen? Next, what may happen? On examination, you may find that patient's skin becomes warm and moist. No, we now know why this, due to patient try to remove heat from his body. Try to remove heat from his body. Yeah? Now, for example, hair texture may become fine, diffuse alopecia may happen, because again, we have acceleration of all processes, but totally this is catabolic process, and that's why it may lead to some problems with hair growth, growth of hairs. Okay, gastrointestinal transit I explained to you. The thyroid. One of signs, this is goiter, diffuse toxic goiter, diffuse toxic goiter, diffuse toxic goiter. Enlargement of thyroid gland is one of the most common signs of this disease. Why we have enlargement? Just because thyroid stimulated to produce more hormones. If they stimulated, produce more hormones, how to produce? They become bigger. They increase in size, the result, they are hypertrophic. We use term hypertrophy. We have hypertrophy of thyroid gland, the thyroid gland enlarged in size and produce even more and more thyroid hormones. That becomes bigger and produce more thyroid hormones. Becomes bigger and produce more thyroid hormones. Thyroid gland becomes palpable. In some cases, it becomes visible. It becomes visible. Next, what may happen? This is so-called Graves' ophthalmopathy. Graves' ophthalmopathy. You know, actually, we have two ideas. We have idea about ocular signs when eyes becomes big, yeah? And we have ophthalmopathy. This is not synonymous. Ophthalmopathy, this is much more severe problem. Again, remember what I told you, that is autoimmune disease. This is autoimmune disease. And specific autoimmune disease with stimulating autoantibodies. But autoimmune disorders usually come together and inducing few autoimmune processes. In case of ophthalmopathy, thyrotoxic ophthalmopathy or Graves' ophthalmopathy, thyrotoxic or Graves' ophthalmopathy. So, just imagine we have orbita, yeah? This is skull, orbita, and in orbita we have eyeball. Orbita covered with some soft tissue, some soft tissues. And sometimes, in case of Graves' ophthalmopathy, we have autoimmune attack directed to soft tissues in orbita. Due to this attack, we have inflammation of these tissues. But all kinds of inflammation lead to edema. The inflammation leads to edema. When edema happens, edema of tissues which placed in orbita. You know, on the back we have bone. That's why if edema happens, what does edema do? Edema starts pushing eyeball out from orbita and eyeball push out of orbita. And in this case, we talk about protrusion. We talk about ophthalmopathy, and this is bad because, again, sometimes this is so severe that eyelids can't completely close eyeballs. It looks like that eyeballs try to leave orbita. It may be one side, it may be two sides, and finally it may lead to very serious problems with eyes, to problems with vision. And in this case, we talk about thyrotoxic ophthalmopathy. Signs just widely open eyes. We treat thyrotoxicosis and everything becomes normal. Ophthalmopathy, this is separate disease. We should use some hormones to treat, ophthalmologists, sometimes make even injections into eyes, trying to stop this process. This is very serious presentation of this disease. Very serious presentation of this disease. In some cases, less than 5% of patients, we may find thyroid dermopathy, so-called. No presentation. This is so-called pretibial myxedema. When we see actually specific skin changes on legs, the pretibial myxedema, no, actually we can see picture, you see this swelling of legs known as pretibial myxedema. Thyroid acropathy, so fingers problems, thyroid acropathy. Again, less than 1% of cases, clubbing, you see the specific shape of nails, specific sphere, the hemisphere shape of nails. No, this is known as thyroid acropathy, So investigations, how to confirm presence of thyrotoxicosis. Hormones. First of all, now we can directly measure level of T3, T4, and of course T3, T4 levels will be increased. And actually, another what happened. Remember I told you about feedback mechanism, about TSH produced by pituitary. When steroid hormones increase, TSH decrease. And in case of pyrotoxicosis, we can expect what? Very low levels of TSH, because a lot of steroid hormones, no need to stimulate, and that's why TSH decrease, and this is one of signs of pyrotoxicosis. One of signs of sterotoxicosis. Again, steroid hormones increase, TSH decrease. TSH decrease. Few words about actually treatment. About treatment of patients with diffuse toxic gout. You know, we have few approaches. We have medication, we have surgery, and we have radioactive substances, radioactive iodine. Medication. Fortunately for patients, we have special remedies which block production of steroid hormones by steroid glands. So, for example, mercazolil, so-called stereostatics, stereostatic remedies which block production of steroid hormones. In our country, we widely use the remedy known as mercazolil. We give tablets, and soon in few weeks, production of steroid hormones decrease, and patient feels himself much better. Also, we use beta blockers, because I told you that many presentations, many signs of pyrotoxicosis due to overactivation of sympathetic nerve system. You know, due to hypersensitivity of receptors to epinephrine. And these receptors blocked by beta blockers. Why beta blockers? They decrease action of sympathetic. Give beta blockers to patients with pyrotoxicosis, such signs as nervousness, such signs as tachycardia, even diarrhea may decrease, because we block the mechanism of these signs. That's why we use beta blockers. Now, in severe cases, we can use corticosteroids as very powerful remedies which usually used to stop some immune or autoimmune processes. That's why this is medication treatment. This is medication treatment. What we can do next? The problem is, if thyroid gland is rather big, okay, we give remedies, patient condition improves. We stop giving remedies, no again, all signs appear again. And we can't give remedies all patients' life, because this is not benign remedy. Stereostatics, this is statics. This is like remedies used to treat, I don't know, tumors, for example, and they may cause even some decrease in production white blood cells, leukopenia in some cases. That's why we can't give long life therapy. And that's why often, if patient has big glands, after we achieve so-called euthyroidism, medication euthyroidism, we send patients to surgeons. Surgeons can do what? They can just cut and throw away extra amount of thyroid gland, because again, thyroid gland becomes bigger, sometimes 2 or 3 times more. If surgeon remove this extra tissues of thyroid gland, size of thyroid gland becomes normal. This normal gland produces normal amount of thyroid hormones, and patient recover. It's like a miracle. You just throw away what patient need now, and patient becomes absolutely normal. And in 75 up to 80% of cases, we have complete recovery. Patient live all his life with small scar on the neck, and we believe that this is complete recovery of patient with pyrotoxicosis. And in rare cases, we can use so-called iodine 131. This is radioactive isotope of iodine. You know, and actually, when we have big and active thyroid gland and patient is in very serious condition, so severe that patient even can't survive during surgery, because all surgeries is severe stress for the body. If it tells a person with heart failure, for example, in this case, we can give iodine 131, and what happens? Patients take this remedy, iodine 131 accumulated in thyroid gland, and what radioactive substances do? Why we're afraid of radioactivity? Why we're afraid of nuclear weapons? Because radioactive substances kill cells, kill tissue. In our case, this radioactive substance kill tissues of thyroid gland. Of course, production of thyroid hormone decrease, and patient recover somehow. Yeah? No, actually, rarely we use this method because a lot of side effects, of course. We can't use it in young people because it may cause damage of some other inner organs. But only in severe cases we can use this type of medication, this type of treatment. So this is what about pyrotoxicosis. This is what about pyrotoxicosis. Okay, if you have questions, you can write questions in the chat. You can write questions in the chat, and I'll try to answer questions. No questions. No, if no questions, okay, next lecture will be on 10th of December. Already 10th of December. So good luck.